Hello people, in this video let us look at some cardiology scrambled words. Let's see if you can unscramble them. What do you think this one is, guys? Let me give you a clue. It starts with B. It's about heart rate. Yes, you guessed it right. It is bradycardia. Very good. Let's try the next one. Come on, try this one. Okay, I will tell you it's about a pulse. Collapsing. Yes, it's collapsing pulse. Very good. Let's try this one. We're looking at cardiology, guys. Before that, guys, what is bradycardia? Let's learn the terminologies also. Bradycardia is basically heart rate which is slow, right? Collapsing pulse, water hammer pulse, Corrigan's pulse. You will see it in aortic regurgitation. So now coming to the third one. What do you think this is? Is it some drug name? Do you want a clue for this? It's more like a two words, guys. Give you the first word. It's peri. Yes, you got it right. It's pericardial. Like pericardial is something around the heart, right? Pericardial effusion, etc. Now let's go to the fourth one. I can give you a clue. It starts with A. Yes, it is aldosterone. Very good. So aldosterone, guys, what do you think it does? It helps in absorption of water, right? Regulation of salt and water. So it makes aldosterone will increase your blood pressure. Now we are at the fifth one. Try this one, guys. What do you think this is? I feel like it's amyloride. What do you think this is, guys? What letter do you think it starts with? Giving you a clue, guys, it starts with myo. What is myo? Okay, it is myocardial because what is myocardial? It's actually the heart muscles, right? Myocardial. Great, people. 5 done. Let's continue. Sixth one. Eat, TPL, pulse, PULTT. What is T? What do you think the answer is, guys? Septal. Septal. Okay, let's go to the seventh one. I can say this very easily. Edema. Very good. Let's go to the eighth one here. NRI, ENRI, nerve, nervy. What do you think this is? Renin. Very good. Renin, angiotensin, aldosterone system, isn't it? So what does renin, angiotensin, aldosterone system do? It will try to increase your blood pressure, regulation of blood pressure basically, right? Very good. So that's why it's there in cardiology. Let's go to the ninth word here. Unscramble this. I can see E, F, F and U, so it looks like effusion. Very good. Effusion, pericardial effusion, pleural effusion, so many things you would have heard of. Let's go to the 10th one. Bricklolate. What is this? What do you think this is? Shall we look at the answer, guys? Or you want a clue? Clue is that it starts with a B. And it's actually kind of two words. So you guessed it right. If it starts with a B and there are 2 words, and I'll give you the second word also starts with a B. Yes, it's a beta blocker. Very good, guys. Very good. It is a beta blocker. So can you give examples of beta blocker? Timolol. Very good. Misoprostol. No. Metoprolol. It's actually metoprolol. Okay. Metoprolol. Then timolol you will use in what is that? Glaucoma, right? 10 done, guys. 10 more done. Are you learning something in cardiology, guys? Let's go to the 11th one. What do you think this is? What do you think it starts with? Clue is that it is the name of a syndrome. Dash syndrome. What do you think you can see here? Very good. I'll give you the clue. It starts with M. Marfan syndrome. Marfan syndrome, something to do with connective tissue disorder, right? And these people will have long fingers, long legs, long arms, and they'll be so flexible, and they'll have problem with aorta. Very good. Okay, shall we look at the 12th one, guys? The 12th one is here for you. What do you think this is? Take your time. It starts with an A. So what do you think it is? Angiotensin. Very good. Angiotensin. Angiotensin is what? Renin, angiotensin, aldosterone system that you saw. Angiotensin. Who makes this angiotensin? Kidney is giving renin. Liver is giving angiotensinogen, which is getting converted to angiotensin 1. So angiotensin, liver and lung. So basically angiotensin is the word that you have cracked now in cardiology, right? Everything about blood pressure, heart rate, etc. Now let us go to, shall we go to the 13th word, guys? Here you go. Hereditary, no, let's arrhythmia, guys. So basically, what are the types of arrhythmias? You know, whenever the rate rhythm of the heart is not proper, arrhythmia, you have atrial fibrillation, right? You have ventricular fibrillation, you have left bundle branch block, so many things, right? Shall we go to the 14th one? What do you think this is? It starts with, all right, no, what is this? It starts with an A, guys. Oh, that's slightly hard. Let's see the answer. Atrial, very good. Atrial means something to do with the atria, right atria, left atria, very good. Let's go to the 15th one here. It looks like a refrigerator or something like that. It's a huge word. What do you think it is? Angio. Take a clue, guys. It starts with R-E. What do you think this is, guys? Let's see the answer. Regurgitation, very good. So you have aortic regurgitation, etc., where you will see water hammer pulse, etc. You're done with 15. Nice work at cardiology. Let's go to the 16th one. Here you go. Ischemia, is that correct? Yes, ischemic. Okay. 17th one, stenosis. Very good. Stenosis. 18th. Are you ready? Say this. No, guess, no, nothing's flashing. Think, guys, it starts with R-E again. Think. Here's the clue. There's your hand. Yes, it is CPR. Cardiopulmonary resuscitation. Very good. Let's go to the 19th one. Aortic, isn't it? Aortic, very good. 20th one, guys. Malar, IT, right, atrium. Mitral. Yes, very good. We have finished 20, that's great. Breathe in and breathe out, guys. We will be looking at around 42 of these. Now let's go look at the 21st one. Look at this. Pulmonary, what do you think this is? Do you have a clue? Remember, it's cardiac topic, okay? So what do you see here? We'll give you a clue. It starts with something. There is a word in between here like pulmonary, something like that. Did you guess it? It's cor pulmonale. Very good. Cor pulmonale. What do you mean by cor pulmonale? Basically, in cor pulmonale, the right side of the heart has failed, is it? Any condition that causes the right side of the heart to fail. So cor pulmonale. Let's go to 22nd one. What do you think this is? Something in cardiology. Come on, you can do it. Cardiology. What is this word? You need a clue? Madrid. No. It starts with an A, guys. A, and it's the name of a drug. So what do you think it is? Yes, amiodarone. Very good. What do you use amiodarone for? To treat arrhythmias. Very good. Let's go to the 23rd one. What is this? MARLP, rest in peace. No, what is this? Need a clue? It's the name of a drug. It starts with R. Okay, so you are guessing it starts with R, RAM, Ramipril. Yes, very good. Ramipril. What do you use Ramipril for? What type of a drug is it? So Ramipril is used in cardiology. It is used to treat high blood pressure, hypertension. Okay. What classification is it? It is an ACE inhibitor. Let's go to the 24th one here. Creepy. Something is definitely creepy here. Creeper. What's the starting letter, please? Something that is fitted in the heart, guys. Try. PA. Pacemaker. Very good. Now let's go to the Nagin. Nagin in the heart. What is exactly this one? Weight gain. Angina. Very good. Angina. Pain, basically. Okay. Now, let's go to the 26th one. Oh, we are done with 25. That's great. So, 25 things you have looked at. That is great. Cardiology terminologies. Now, let's try to find this 26th one. Nephro, hypertension. But hypertension doesn't have O in it. So, what exactly is this? Let's take a clue. Actually, it has a O. Hypertension. T-E-N-S-I-O-N. Yeah. Answer is hypertension. Very good. Index, iodex. God. What do you think this one is, guys? Do you need a clue? I think some of you have already guessed it. It starts with a D. It's the name of a drug. Oxin. Yes. Digoxin. What does digoxin do? In cardiac failure, they give digoxin, right? What exactly does it do? It will make the heart contract more. Better. Okay, let's go to this one. Ventricular. I can see it. Yes, ventricular. Anyways, it's cardiology. You should be able to say it because we have told you the topic already, right? What is this one? Undan, citron, no. This is something nice. N-I-C-E, I see here. What do you think it is? You want a clue? It starts with this letter here. E, which you wouldn't have guessed at all. And it is kind of two words. Okay. E-N-D-O. Endo. Endo. If you remove E-N-D-O. What is left here? Carditis? Yes. Endocarditis. What is endocarditis, guys? You have heard in infective endocarditis. Basically, the valves are having bacterial infection, right? Infective endocarditis. Inflammation of the inner lining of the heart. Basically, it is caused by bacteria, so it can be infective endocarditis. Okay, 30th one. Fibril, I can see here. So it is a D, defibrillator. Very good, defibrillator. You must have heard. What does it do? It will shock and get you a better rhythm for the heart. You would have learnt it in emergency medicine, isn't it? Let's, we have finished 30th one, guys. We have to enjoy. Target is 42, guys. So let's look at the 31st one now. Come on, let's do it. 31st one here. Officinator, renin. What do you think this is? I'll give you a clue, guys. It's kind of starting with I. Infarct. Yes, you got it. Infarction. So basically, infarction is what? After an ischemia, it will go into infarction. What do you mean by infarction actually? It's a necrosis, right? Tissue death, necrosis due to ischemia. You will say infarction. Okay. Now let's go to the next word here. Fibrillation, fibrillator. Again, same thing. Is it slightly different? Yeah, fibrillation. I think we already saw this word. What do you see? Pulse. That's the easiest one we can get. Pulse. Okay, here we are. 34th. Heart. Yes, heart. Cardiology. 35th one. Coordinate. Carditis. Definitely something to do with cord. Okay, card. C-A-R-D. I will remove. Card is over. Cardio vert. Very good. Cardio vert is the answer. Cardio vert. What do you mean by cardio vert? You will restore the normal rhythm of the heart. Okay, that is cardio vert. Very good. So we are done with 35, guys. So we are going to the last few. Let's look at the 36th one here. Jugular. Actually, it is so easy. Jugular. Yeah, it's already there. So your jugular vein, jugular venous pulse, JVP. That's why it is there here. Sconske. What do you think this is? Coniske. Any clue, please? It starts with the C. Coniske. It's actually difficult. But look at this color here. This blue. So what do you think this is? Starting with C. Yes, it's cyanosis. What is cyanosis, guys? Why does it happen? Cyanosis is basically blue, right? Cyan, blue. Why does it happen? Decreased amount of oxygen, which is bound to hemoglobin, right? So hemoglobin doesn't have oxygen. So it is blue. Okay? It's appearing blue. Okay, what is this? SSDAEIE. What is the SAD? Something SADY. Aedes aegypti mosquito. Actually, this has nothing to do with cardiology as such. You can just say medicine. It starts with a D. D-I-E, right? D-I-S-E, disease. Okay. Next, Tiloff, Aloff, Taloff, Fallet, Fallet's tetralogy, overriding of aorta, pulmonary stenosis, VSD, right ventricular hypertrophy, right? Okay, look at this one. Tularemia, Mia, heart, H-E-A-R-T. Can we remove that? H-E-A-R-T. M-I-U-C. I-U-C. I-C-U. What do you think this is, guys? Not able to get it? Rheumatic. Rheumatic has the letters for making a heart in it. H-E-A-R-T. Rheumatic, but okay, rheumatic. Rheumatic heart disease is caused, what it is? Post-streptococcal? Yes, very good. Last two, guys, last two. We are at the last two of cardiology. Unscramble. Look at this. Unstable. What is this? Perfectly right, guys. Unstable. Last one. Murmur. Very good. Murmur. That's nice. What do you mean by murmur, guys? Basically, heart sound, right? Whooshing, swishing, turbulent blood flow in the heart, right? So in this video, you looked at all these cardiology words, terminologies. Hope you have learnt something, guys. So these were the words that you have learnt in this video. Bye bye.